The role of the radiologist is to provide answers to questions that clinicians have about their patients. Questions like,
is the ground glass opacity in the lung actually a reticulation?
Can you see signs of osteoporosis in the wrist scan of this elderly patient?
Is the coronary stent still patent, or is there restenosis?
Clinicians need answers to these types of questions to make informed diagnostic and treatment decisions. To provide those answers without delay and with a high level of diagnostic confidence, the radiologist needs a clear and precise picture of what is going on within their patient. Conventional CT technology can only visualize a limited level of detail without breaking the ALARA principle, as higher levels of detail either require high radiation doses or are technically impossible to achieve. Now, thanks to quantum technology, Neotome Alpha is redefining computed tomography. Introducing Quantum HD. Quantum HD allows clinicians to visualize patient anatomy at a level of detail previously not achievable in whole-body CT. With the size of photon-counting detector pixels reduced by a factor of 9 compared to conventional CT technology, Quantum HD provides increased spatial resolution without the dose penalties associated with comb filters and light-reflecting septa. The result? A level of clinical detail previously unseen in CT imaging. This supports a confident diagnosis of interstitial lung disease by allowing a better differentiation between reticular patterns and ground glass opacity, visualizing early signs of degenerative diseases like osteoporosis, and using Quantum HD Cardiac at full temporal resolution to empower the radiologist or cardiologist in their assessment of the lumen of small coronary stents to rule out in-stent restenosis. Quantum HD, enabled by quantum technology. Available on all Neotome Alpha scanners.
Since its inception at the end of the 1990s, the coronary CT angiography, or coronary CTA scan, has become a valuable tool for radiologists and cardiologists around the world. Around 15,000 of these scans are performed each day worldwide. It displays the coronary vessels of the patient in high detail and allows an evaluation of the lumen, stenosis, coronary plaque, and many other cardiac pathologies. However, a significant number of patients cannot benefit from this diagnostic test. Severe coronary calcifications present in around 45% of heart patients above the age of 67, can cause severe imaging artifacts in coronary CTA scans and make a confident evaluation impossible. To assess such patients, they often have to be referred to the cath lab for diagnostic imaging. Compared to a coronary CTA, however, a diagnostic cath lab requires more preparation and staff, takes more time, is more costly to the hospital, and is a more invasive procedure with more risks and discomfort for the patient. Also, it keeps the hospital's cath lab occupied with the diagnostic procedure instead of an intervention that potentially would create more revenue. Can we redefine this clinical pathway? With Neotome Alpha, the world's first photon-counting CT, radiology departments routinely produce coronary CTA images at high spatial resolution that contain the full spectral information, independent of heart rate and arrhythmia. This enables a system to perform what is called a material decomposition, splitting the image into its iodine component and its calcium component. With this information, a feature called Quantum Pure Lumen is able to virtually remove all calcium from the image, leaving the lumen enhanced by the iodine contrast untouched. It produces an additional image free of calcium and its typical blooming artifacts at the click of a button. Dedicated Quantum Pure Lumen recons can also be sent to any PACS system for further review. Based on the information in our spectral post-processing datasets, these additional reconstructions can also be created retrospectively, long after the patient has left the radiology department. This will allow the radiologists and cardiologists to potentially evaluate more patients with larger amounts of calcifications based on their coronary CTA images alone. In summary, Quantum Pure Lumen utilizes the high-resolution spectral images from NeoTOM Alpha to create an additional series at the time of the scan or retrospectively that allows clinicians to assess the coronary vessels even in the presence of severe calcifications, potentially saving patients from avoidable additional, more invasive imaging in the cath lab. Furthermore, Quantum Pure Lumen can be applied not only to coronary CTA, but to any CT angiography exam where calcifications limit diagnostic confidence. Quantum Pure Lumen, enabled by quantum technology. Available on all NeoTOM Alpha scanners.
Perception, understanding, reasoning, creativity, wisdom, learning, intelligence, the ability to think abstractly and rationally and use that thought for purposeful action, the strongest tool of humankind. And a concept that we have pushed even further, making technology our strongest partner and giving us the confidence we need to make the right decisions intelligently. My exam companion is intelligence that works with you. It uses the new possibilities of digitalization to turn data into built-in expertise. To unlock the full potential of the Somatome Go platform, My Exam Companion guides users on their way, delivering better outcomes to more patients for a successful CT business. My Exam Companion, intelligence that works with you.
I'm very self-aware of my body size. But that's life. Life isn't designed for people of my size. Life is designed for people of a smaller stature. And you just have to get on with it. My body size is that it helps me doing shows as Henry VIII. Each day you get up and think, oh, what am I doing today? Every day is different, so I'm lucky.
A broken hip feels like somebody's took a hammer and just hit you in the hip, and then it like crunches every time you move. It was horrible, it was terrible. I did a lot of maintenance to make sure I could stay on the court. Basketball means everything to me.
I was born with asthma. The best way I think to describe it would be, it's like drowning from the inside. It's not being able to breathe out, and that's why people will die. I don't know why I can play the trumpet. It might just be practice. You're fortunate to have a life, so do something with it.
Seimens Healthineers presents Transforming Care Delivery in MRI with Biomatrix and Go technologies for an optimized workflow. It streamlines your clinical operations all the way from patient preparation to results distribution. It's guided, intuitive, and above all, fast. Starting with patient preparation. Biomatrix captures and uses individual patient information for a more efficient preparation. For example, the Biomatrix interface Select and Go cuts your positioning time by up to 30%, using patient-specific information and artificial intelligence-based algorithms. Simply select the body region to be scanned, and the patient will be automatically positioned correctly without any additional laser positioning. During the acquisition, .Go makes scanning more intuitive and consistent. Easily manage your scan protocols and benefit from user guidance and intelligent automation. For example, artificial intelligence automates exam planning, making scanning more consistent and reproducible. Save time and reduce workflow steps with Recon and Go. Recon and Go automates reconstruction tasks with 0 clicks. For example, inline composing of whole spine exams and vertebrae labeling in all planes can be performed without any user interaction. Be one step ahead with the all-in-one viewing and post-processing solution, MR View and Go. MR View and Go provides intuitive tools that manage and distribute results efficiently and enables advanced post-processing such as perfusion mismatch analysis directly at the scanner. Results can be sent to PACS ready to read and saves valuable time for the radiologist. With the optimized MRI workflow powered by Biomatrix and Go technologies, it's possible to reduce the average exam slot from 30 to 20 minutes. This allows you to schedule one more patient per hour. The new level of MRI workflow from Seimens Healthineers help you transform care delivery and optimize clinical operations.
We perform ultra-high resolution imaging of the hippocampus now at 7 Tesla. And when we look on these images here, we can see on these diagrams here the different subunits within the hippocampus substructure. And this substructure is only visible when we have a real high spatial resolution, which is provided by 7 Tesla using turbospin echo technique, which was optimized for this particular sequence and for this particular visualization. And when we look on the in vivo image, which is shown here on both sides with the hippocampus, we can nicely correlate each of the different subunits in correlation to the diagrams which show what we should see in the hippocampus. And 7 Tesla has the high resolution which allows us to provide this information, and we can use it in patient populations, for example in patients suffering from temporal lobe epilepsy, because in these particular patients we know that the focus of their disease may be only in 1 or 2 of the subunits of the hippocampus. Otherwise, when we cannot differentiate the subunits, we miss the focus in these particular patients. And in addition, in patients suffering from morbus Alzheimer, the hippocampus also plays a role because we know that some atrophy may occur in the hippocampus, and we believe that we see more by using this ultra-high resolution. Here we see a slice through the hippocampus, a single slice with a very high resolution of 0.2 millimeter in plane. And here we see a video where we go slice by slice through the hippocampus from the head over the body to the tail of the hippocampus. It's once again repeated, and you can see all details of the hippocampus in this high-resolution imaging at 7 Tesla. Here we see an example of susceptibility-weighted imaging at 7 Tesla in a patient with a brain tumor. And this is a high-resolution SWI image with a 0.2 millimeter in-plane resolution. When we look on this image, we see a wealth of detail with the small white matter veins running perpendicular to the ventricles. And what's very obvious here is the following. We see a large malignant tumor. And when you compare the left side with the right side, you see that the vessel architecture changes because the tumor needs the nutrition by the vessels. And when we zoom it, we can even better see all the small veins details which are provided by this high-resolution SWI image. Here we see two examples of brain tumors. Both are gliomas. In the upper row we see a high malignant glioma, it's a glioblastoma, and in the lower row we see a low malignant glioma, it's an astrocytoma. And what we can see by using susceptibility-weighted imaging is that we have a very high susceptibility effect within the tumor based on vessels, on small bleedings within the tumor. And we can calculate, which is shown in color here, the so-called local variability based on this amount of heterogeneous susceptibility effects. In the lower row, we see that with the low malignant tumor, we have a very low susceptibility effect within the tumor. This results in a very low local variability. And finally, this means that by using SWI, we are able to differentiate between high-grade and low-grade malignant tumors in the brain.
We found something that might be serious. A sentence everyone fears. Everything goes numb, and suddenly you desperately try to interpret every movement, every facial expression on your physician, and 1,000 maybes flash through your head. Maybe I must talk to my family. Maybe I will lose my hair. Maybe I don't have the strength for this. Suddenly, your life becomes unforeseeable. You feel vulnerable, weak, and helpless. The last thing you want in breast cancer screening is a maybe. With Mammomet Be Brilliant, our next-generation mammography system, we are introducing Platinum Tomo, a new dimension in image quality, enabling accurate and uncompromised results for every patient. Smart, fast, and intuitive workflows taking patient centricity to a new level and offering a convenient path to diagnostic clarification. We cannot take away the worries that come with a breast cancer diagnosis, but we can fight the anxiety caused by uncertain results. All to exclude the maybes.
To be sure of your results, sometimes even excellent 2D images are not enough. That's where interoperative 3D comes into play. Move through every dimension directly in the OR, coronal, sagittal, and even axial. Get new perspectives. To confirm your results right there in the OR. And because we know that finding the right planes can be tricky, we detect the screws for you Just switch from one to the next automatically at the touch of a button. With Screw Scout, CO Spin gives you more certainty in demanding cases. More certainty with interoperative 3D. New perspectives, full control. CO Spin, mobile 3D imaging for interoperative quality assurance.